Hello and welcome to Family Doctor, the channel where we break down complex medical topics into simple, clear advice for you and your loved ones. Today, we're shining a light on a sneaky condition that often gets misdiagnosed, Piriformis Syndrome. Have you ever had a nagging pain deep in your buttock that travels down your leg, making you think it's sciatica or a slipped disc? Well, the problem might not be in your spine at all. It could be a small muscle called the piriformis, located deep in your glutes, that's causing all the trouble. Many people suffer for months or even years treating their back when the real issue is muscular. So, let's dive into the 11 most common warning signs of Piriformis syndrome that you should never, ever ignore. First, what exactly is Piriformis syndrome? Let's take a look. Deep within your buttock, you have a small, pear-shaped muscle called the piriformis. It runs from your lower spine to the top of your thigh bone. Now, the sciatic nerve, which is the largest nerve in your body, typically passes right underneath this muscle. In some people, it can even pass directly through it. Piriformis syndrome occurs when this muscle becomes tight, inflamed, or goes into a spasm. When that happens, it squeezes or irritates the sciatic nerve. This pressure creates pain that feels just like sciatica, sharp, shooting, and radiating, but without any actual damage to your spine or discs. The problem is purely muscular. So, what causes this? The most common culprits include sitting for long periods, especially on hard surfaces or with a wallet in your back pocket. Overuse from activities like running or cycling can also trigger it, as can having weak glute muscles, which forces the piriformis to overcompensate. Muscle imbalances in the hips or even a direct trauma like a slip or fall can set it off. Now, let's get into the 11 key symptoms. Recognizing them is the first step to getting the right treatment. Number 1 is a deep buttock pain. This isn't a surface-level ache, it's a distinct, deep pain, usually on one side. It can feel like a persistent, dull ache or even a sharp, stabbing sensation. Many people describe it as having a knot or a bruise deep inside their buttock that just won't go away, no matter how much they try to rub it out. Number 2, pain that radiates down the leg. This is the symptom that makes everyone think sciatica. The pain starts in the buttock and can travel down the back of your thigh, sometimes reaching your calf or even your foot. However, a key difference is that with Piriformis syndrome, the pain usually starts in the buttock, not the lower back. Number 3 is pain that gets worse when you're sitting. This is a classic sign. Sitting for extended periods, especially in a car or at a desk, puts direct pressure on the piriformis muscle, making the pain much more intense. You might hear someone with this condition say, "I can stand or walk just fine, but sitting is absolute torture." Number 4, difficulty sitting cross-legged. Trying to cross one leg over the other, like sitting with your ankle on the opposite knee, can cause a sharp pain or a feeling of extreme tightness in the buttock. This position directly stretches the piriformis, and if it's inflamed, it will definitely let you know. Number 5 is pain when climbing stairs or walking up an incline. These activities require your glute and hip muscles, including the piriformis, to work harder. If the muscle is already irritated, this extra effort can cause a sharp, stabbing pain or a feeling of weakness in the hip. Symptom number 6, numbness or tingling in the leg. When the piriformis muscle compresses the sciatic nerve, it can interfere with the nerve signals. This can lead to that unsettling pins and needles sensation, numbness, or tingling that travels down the back of your leg. It's the nerve telling you it's being squeezed. Number 7, pain that worsens after exercise. While exercise is generally good, certain activities can aggravate Piriformis syndrome. Repetitive motions like running, Cycling or squatting can fatigue and inflame the muscle, causing your symptoms to flare up either during or after your workout. Number 8 is limited hip rotation. The piriformis muscle helps rotate your leg outward. When it's tight and inflamed, this movement becomes restricted and painful. You might notice this most when you're trying to get out of a car or when you rotate your leg to the side. It just feels stuck or blocked. Number 9. Tenderness when you press on the buttock. If you press firmly on the center of your buttock, right over the piriformis muscle, you'll likely find an extremely sore spot. This is what's known as a trigger point, and for people with Piriformis Syndrome, this area is often exquisitely tender to the touch. Number 10 is trouble sleeping on one side. Lying on the affected side can put direct pressure on the irritated muscle and nerve, leading to a dull, throbbing ache that can be intense enough to wake you up in the middle of the night. You might find yourself constantly shifting positions, trying to find some relief. Finally, symptom number 11, and this is a crucial one, the absence of lower back pain. This is one of the biggest clues that separates Piriformis Syndrome from true sciatica caused by a spinal issue, like a herniated disc. With Piriformis Syndrome, the pain and symptoms follow the path of the sciatic nerve, but your lower back itself usually feels perfectly fine. The problem isn't in your spine, it's in your buttock. So, how do doctors confirm if you have it? There isn't one single, definitive test for Piriformis Syndrome. Instead, we diagnose it by piecing together clues from your physical exam and by ruling out other potential causes. We start by listening to your symptoms. Then, we perform specific physical tests. One common one is the FAIR test, which stands for flexion, adduction, and internal rotation. In this test, we move your leg into a position that stretches the piriformis. If it reproduces your pain, that's a strong indicator. We also palpate, or press on, the piriformis muscle to check for that characteristic trigger point tenderness. We'll watch you walk to evaluate your gait and assess your hips' range of motion. Finally, we may order imaging like an MRI or X-ray, not to see the piriformis muscle itself, but to rule out other problems like a herniated disc, spinal stenosis, or hip arthritis that could be causing similar symptoms. If you are diagnosed, the good news is that there's a lot you can do to find relief. The focus is on relaxing the tight muscle and strengthening the surrounding area. Gentle piriformis stretches are key. Your doctor or physical therapist can show you specific stretches, like the figure for stretch, to help release tension. Strengthening your gluteal muscles, particularly the gluteus medius, is also crucial. When your glutes are strong, the piriformis doesn't have to overwork. Simple lifestyle changes, like taking breaks from sitting and avoiding carrying a wallet in your back pocket, can make a huge difference. Applying ice or heat to the area can help reduce inflammation and soothe muscle spasms, and in some cases, a doctor might recommend anti-inflammatory medication. The most important thing is that early recognition and proper treatment can prevent this from becoming a chronic, debilitating problem. So, to wrap things up, if you're experiencing that sciatica-like pain shooting down your leg, but your back feels completely fine, don't ignore it. The culprit might just be that small hidden piriformis muscle. Listen to your body, pay attention to these 11 signs. And don't hesitate to seek medical advice to get an accurate diagnosis. Thank you for watching Family Doctor. If you found this video helpful, please give it a thumbs up, share it with someone who might need it, and subscribe for more health insights to help you and your family stay well. We'll see you in the next video.